بسم الله الرحمن الرحيم. هنتكلم النهاردة عن communication. Today we will discuss the communication station 4. Communication start in station 4. It lasts for 14 minutes. After 12 minutes you will get alarm from the examiner that there are 2 minutes remaining, and after that they will give you 1 minute to revise what have you done with your case, and have 5 minutes to discuss with the examiner. What the examiner remark you in this station on clinical communication, on clinical judgment, on the concern, and on the welfare. This is the main parts of remark in this station. The main and the bulky part of the station itself is clinical communication. What is the meaning of the clinical communication? Clinical communication is the way to discuss the medical issue with your patient in empathic, professional, not hesitating manner, with maintenance of eye contact, which is really important in cases of station 2 history and station 4 communications. And sometimes if someone fail in this station may be related to poor eye contact, so you have to make it clear, professional, show empathy to the patient, and maintain good eye contact. The clinical judgment, as we discussed before, with the patient you have to tell him the actual management plan you will take with the patient, the investigations, the blood investigation, the scans you will do for him, X-ray, CT scan, biopsy if it's needed, the treatment option to the patient. The treatment option will be under a multidisciplinary team which consists of our consultant, your GP, specialized nurse, the smoking cessation clinic, alcohol modifying group therapy, social worker, even if you need DVLA advice for driving. And the last thing, or before the last thing, is a concern. The concern, you have to ask clearly and properly about the concern by asking, may I ask you what is your concern? Do you have any question right now? And answer it directly, without hesitation and without delaying. About the point of welfare, all of us, mostly all of us, take these points and these marks points, but the one who did not take it, or who do not take it, the one who disturb or harm the patient, The composition of each scenario we are taking in communication is divided into the introduction. You have to introduce yourselves to the patient. I am Dr. Salama. I'm here today to discuss your health condition and to confirm the agenda and to take his or her consent. Is that okay with you? Is that good for you? Then ask the patient how he feel right now. Do you have any problem right now? May I ask you, how do you feel right now? Do you have any problem right now? May I ask you why you are here right now? Ask about the expectation, and this is one of the most important thing in the introductory. You have to ask the patient about his expectations, and we will know why the expectations is important in cases like dealing with angry patient, or breaking bad news, or ventilate or no ventilate, or organ donation. Then you will start your rule here and try now to show yourself to the examiner and to the patient, and try to discuss the medical issue for the patient. After you discuss your medical issue, you have before the management plan and before asking the concern, you have to take some proper social and family and the past and drug history. You have to ask the patient with whom you are living with. What is your job? Do you have any bad impact on your daily activities because of the disease that you have or the problems that you have? Do you have any family history of long-standing disease? Do you have any past medical history of long-standing disease like diabetes, like hypertension? Do you have any drug list, or do you have any drug allergy to any medication? This is important because here it's a case of communication. It's a case of communication. You have to have a good communication with the patient. Be a good communicator. Then ask about the concern. What is your concern, and answer the concern. Most of the cases in station 4, their concern is not about their health condition. It's mainly about another thing like driving. Like I have a debilitating disease right now, and my wife had rheumatoid arthritis. What should I do with her? Then construct your management plan. Non-pharmacological and pharmacological or multidisciplinary team, which include blah 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 as we told before. Then recap to the patient. Can you tell me what did you get from our discussion today? What is the message you will take with you to home today? And finalize your case by giving the patient your hospital contact number, giving him websites and brochures to read more about his disease, and ask if he has any other concern to respond to your patient. Then you will have, after you finish, or after the examiner told you finished your case now, you have 1 minute to review yourself, and then we will discuss the case with you. In that 1 minute, it's not for relaxing. This 1 minute is not for collecting or seeing yourself in the past few minutes. What did I do? What have I done? No, this 1 minute is to write 5 main issues in your paper. What is the case type? Is it counseling? Is it breaking bad news? Is it organ donation? Is it dealing with angry patient? What is the ethical issue in this scenario? Is it about confidentiality? Is it about doing harm to the patient or not doing harm to the patient? Is it about dignity? Is it about justice? And the legal issue. The legal issue. Is it consent? Do we have to take a written consent from the patient? Is it about advanced directive? Is it about a living will? What exactly is the legal issue that present inside your scenario? Then driving. Maybe patient have a problem in vision. Maybe he has a problem with myocardial infarction. Maybe he has a problem with his diabetes. So you have to discuss that you will refer him to the high authority of DVLA to make a proper plan if he can drive or not. Then what is the management plan? You told the patient, will you admit him or not? Who will be responsible for the main treatment for the patient? In which specialty? Who is the consultant is responsible for that? And is the GP, specialized nurse, Macmillan nurse in cases of cancer, specialized nurse of rheumatology in case of rheumatic disease, specialized nurse of nephrology in case if patient need dialysis. So to revise in this 1 minute, you have to write the case type. Is it counseling about disease? Is it breaking bad news? It's communicable disease. It's due to it's about organ donation. It's about ventilate or not ventilate. Then the ethical issue, the main ethical issue here, autonomy. The patient should know everything about his case and about the treatment, beneficence or benefits. I couldn't write beneficence or doing good for the patient, and the maleficence, doing no harm for the patient, and justice, that every person should be treated regardless his race, religion, or gender or sex. And then the legal issue, the consent, the advance directive, is it about living will, and if it is about last power of attorney. And driving, is there any specific issue in our case that related to driving? He must stop driving because he has epilepsy. He must stop driving because he has recently myocardial infarction. He has to stop driving because he has a problem with his vision right now. And the management plan, and you will start the management plan, your management plan, with admission or not, and then the consultant and the GP and the specialized nurse, the social worker, the occupational therapist. Those 5 main issues will be discussed with you by the examiners. This is mainly what will be discussed with the examiners. So in this 1 minute you have to write these 5 points in your paper to discuss with the examiner. Those you will be remarked for and you will get your marks for. Okay. What are the most common scenarios that are present in the communication or station 4? There are a lot of scenarios. The most common one, which have been come lately more and more, is dealing with angry patient. How to deal with angry patient. The second one is breaking bad news. The third is counseling about disease and also is associated with breaking bad news. Counseling about procedures. Communicable disease, how to proceed in a case of communicable disease, and others like communicable and like organ donation, ventilate or not ventilate, giving advices to patient who has osteoporosis or patient who has recently myocardial infarction. A lot of cases, but the main is dealing with angry patient, breaking bad news, counseling about the disease, and counseling about procedure. 5th is communicable disease. Starting from now, it's just a small lecture or communication bullet, like what I nominated it. You can compose your own songs lyrics and your own scenario lyrics to discuss any scenario with any patient, whatever the scenario is, because they all have the same component. You know it or you don't know the scenario. Is it a new one or it's old one? Now you have the ability to compose it by knowing the main issue is introduction. Confirm the agenda and taking his consent. Ask how he feel right now. Ask about the expectation. Your rule will start after asking the patient expectation, and then taking the proper social and family and past medical and drug history. Then asking the concern. Put your management plan, recap and or summarize and finalize your case. That's all for now. Just relax now, and we will take the second bullet soon. And thank you too much, and appreciate it, and hope that you gain some of experience about communication skills in this small lecture or bullet, communication bullet. Thank you too much.